Hey future nurses, my name is Danielle and I wanted to make a quick video for you guys who are about to take the Nclex, and hopefully all of you are going to pass. I'm assuming if you're Googling this kind of stuff, then you're that kind of student, you are going to pass. But previously to taking it, I was constantly Googling more than studying, probably different tips and tricks, whether the Pearsonvue trick works, what material do I use to study, how do you even figure out what to study and all that stuff. So for Uworld, I just did the 30-day subscription because I took the Nclex 30 days after graduating, and I did every single question in the UBank. When I first started, my percentile rank was 13. Now, it could be because I had omitted some questions and I didn't understand stupidly that would have played a part in the weighing of everything. But I still only ended in like the 42nd percentile, and I did every question. And I also did, you can choose to do incorrect questions in the test bank, and I had like maybe 400 left over incorrect that I didn't get to do a second time before I took the test. And Uworld helped tremendously. They really just teach you how to answer the question, and when you read all the rationales, you'll remember that while you're taking the test, and you'll be like, oh, I shouldn't pick that because A, B, and C. And I remember on Uworld them specifically saying it. 3 days before I took the test, my friend told me about Nclex, and I listened to one of his lectures, and it was really, really, really helpful. During the exam, I heard his voice, and I know I got the answer right because it hit like a select all that apply the next question. So you know you're doing well if the questions are getting like consecutively harder. But that's all I did with that. So I just did the Uworld questions. I didn't take notes. I didn't go back over anything else except for the questions I got wrong, and even then I just read through everything and then went to the next one, and I passed. I had 150 questions, which is the most I think you can get during COVID time. And I'm not kidding you, it's nothing like you expect. I thought I failed because I didn't even recognize some of the things on there. Turns out I didn't fail though, which is good. But so it's not gonna be what you expect. So I wouldn't sit there and memorize all these lab values and like, you know, how the kidneys work and how the liver works. It's just know your signs and symptoms, because like, think about it, you're going to be a nurse, so you just need to know how to treat the signs and symptoms. And you know, if someone has something wrong with the liver, you're looking at the AST and the ALT, and it's more common sense, guys. Like, we learn this, you know it, so just relax. And I have friends who they're freaking out and they're using like 50 different study materials, and that's going to trip you up in the end. Just focus on a couple of things and keep that. And you know how to study, like, you know yourself. So trust yourself. And I still passed in the low percentile ranking. So don't pay attention to that or your assessment scores, like nothing like that. And there's something else I was going to say. Oh, the Pearsonvue trick works. And I was shaking the whole time I was typing in my credit card number to like try and, for those of you who don't know, as soon as you're done, you can go back to the Pearsonvue site, sign in again, and try and re-register for another Nclex exam. You go through the whole thing, like you need to put in a credit card number. Just change the expiration date to a wrong date so it doesn't go through if you did fail and it lets you go. Just to be sure, because who wants to lose $200? So you go through, you have to hit submit. And then you'll either get the good pop-up, or it'll say like your credit card number's expired, and that means you failed. The good pop-up will say, I recently took that test and you're not allowed to re-register at this time. 100% of the time it's right. I got the good pop-up and I was still scared that I somehow failed it, so I didn't let me get myself get the hopes up, but I did get the passing email 48 hours later. So if you're gonna do the trick, just wait until you get the email saying you completed the test, and then go ahead and try it, and you're gonna pass. So good luck, guys. Please leave any questions in the comments. Not even sure if anyone's gonna be able to find them.